Good afternoon. This is Group 9, Community and Intervention Management Improvements of Type 2 Diabetes in Hispanic Patients. I am joined today by Danea Garcia, Monye Manning, Sarah Yedley Franco, Uriel Aranda Valerio. This is for the College of Nursing, University of Texas, El Paso. Class Nursing 3214 Evidence-Based Research with Dr. Cristina Dominguez de Quesada, PhD, RN, CNE. Next slide, please. Our introduction today, we're going to be focusing on the fact that there's a drastic prevalence difference of type 2 diabetes amongst the Hispanic population. In the United States alone, there's an estimated 37 million adults diagnosed with diabetes, both type 1 and type 2. With this being only the adult population, this number is especially concerning because the upward trend in diabetes amongst the US population in recent years, it would stand to argue that this number will only continue to rise as our current childhood demographic ages into adulthood. Of the total number of people that have diabetes in the United States, Hispanic Americans are diagnosed with type 2 diabetes at a rate of 2 to 3 times that of non-Hispanic individuals. Evidence shows that 50% of individuals with type 2 diabetes demonstrate low self-management behaviors. This could be something as simple as missing a blood glucose reading, just straying outside of their dietary guidelines and putting themselves into a hyperglycemic state that could result in either a hospitalization, emergency room visit, or over a long enough period of time, potential organ damage. This management of diabetes through a focus of compliance with diet, testing, and a medication regimen and monitoring could greatly reduce the occurrence of adverse outcomes for diabetic patients. This presentation hopes to outline the importance and effectiveness of community-based perception changes and behavior modifications reinforced through Hispanic intercommunity engagement. Next slide, please. For our case study, we chose a 47-year-old Hispanic female who was diagnosed with type 2 diabetes in 2024. This patient has no other comorbidities and denies any alcohol or tobacco use. Patient states that she sometimes has difficulty with sticking to an exercise plan outside of walking due to a lack of interest in traditional workouts that are more gym-centered. The patient also states that she takes several supplements, including magnesium, biotin, collagen, iron, vitamin D, and occasionally Tylenol or ibuprofen, with no other over-the-counter drugs or supplements outside of her prescribed diabetes medication. Patient states that she is happy with her care and that her geographical location, being here in El Paso, Texas, has not presented any difficulties with her finding or receiving quality care. The only other difficulty that she experiences is adherence to a restrictive diet because of her love for food. I think most of us can agree to that. Knowing that there is a balance to be struck between effective care and quality of life is sometimes something that is missed in our nursing care or how we talk to our patients. Also, offering alternatives for patients to enjoy food that is similar to what they love without having negative health outcomes is also important. Engagement of individuals through a community approach can help with compliance, finding ways to reach patients that allows them to feel as if they're no longer ostracized from the community that they identified with growing up. It could be quintessential in how we manage type 2 diabetes. Next slide.
Can you guys hear me now?
Yes.
Okay, sorry about that. The key components for our PICO statement is going to be the population patient amongst middle age 45 to 64-year-old Hispanic female with type 2 diabetes mellitus intervention. How does participating in culturally tailored diabetes self-management education program incorporating structured education and lifestyle modification support? Comparison. compared to standard non-culture tailored diabetes care or medication management alone. Outcome is to improve glycemic control, HbA1c levels, and diabetes self-management behavior within the 6 months and time over a lifetime to improve quality of life. Next slide. The PICO question that we have is a middle-aged 45, 65-year-old Hispanic Latin woman who has had type 2 diabetes mellitus. How does participating in culturally tailored diabetes self-management education and program incorporating structured education and lifestyle modification support as compared to standard non-culturally tailored diabetes care or medication management alone? Affects glycemic control, HbA1c levels, and diabetes self-management behavior within the 6 months to have an increased quality of life. The research statement that we did, we first started off by interviewing our case study participant that has type 2 diabetes who has been facing barriers with glycemic control, health, and culture beliefs. How does participating in culturally tailored diabetes self-management education program incorporating structured education and lifestyle modification support as compared to standard non-culturally tailored diabetes care or medication management alone? How does participating in culturally tailored diabetes, wait, I did that one. Okay, and then our research, we researched with database of CINHEL and PubMed. With PubMed, we merged all our information together that we obtained to make a unanimous conclusion.
Okay, so for the synthesis of evidence, we found 3 articles, 1 quantitative, 1 qualitative, and 1 systemic review and meta-analysis. So the first study, the quantitative study, was this article that was evaluated the effectiveness of culturally tailored diabetes self-management education and support programs delivered in Hispanic church settings. The study included 271 Hispanic adults with type 2 diabetes from 60 churches in San Antonio, Texas, and followed participants over a 12-month period. Researchers measured several outcomes, including HbA1c levels, waist circumference, diabetes distress, and self-care behaviors, and diabetes self-efficacy. The results showed that both education programs improved diabetes self-management, increased participants' confidence, and reduced diabetes-related distress. In addition, the faith-based education group achieved significantly lower HbA1c levels at the 6-month follow-up. These findings suggest that culturally tailored community-based education programs can successfully improve diabetes management and encourage healthier lifestyle behaviors among Hispanic adults. Next slide. So the second article was a qualitative study. Its purpose was to explore the barriers and facilitators that influence the use of continuous glucose monitoring, or CGM, among Hispanic adults with type 2 diabetes. So the researchers recruited 16 Hispanic adults from the University of Miami Endocrinology Clinic. Participants took part in 4 Spanish language focus groups sessions before and after using the continuous glucose monitoring device for 30 days, followed by an 8-week follow-up. The study identified several barriers to CGM adoption, including cost, insurance limitations, language barriers, limited provider education, and concerns about wearing the device. However, participants also reported that using CGM improved their understanding of how food affected their blood glucose and helped them better manage their diabetes. By the end of the study, 11 of the 16 participants had independently obtained a CGM device, which is great. Overall, this study demonstrates that culturally appropriate education and improved access to diabetes technology can positively influence diabetes self-management. Next slide. So the last article that we found was the systematic review and meta-analysis. This article examined the effects of nurse-led diabetes self-management education for adults with type 2 diabetes. This type of study provides one of the highest levels of evidence because it combines multiple findings from multiple randomized controlled trials. So the researchers analyzed data from specifically 8 randomized controlled trials evaluating nurse-led diabetes education programs. The review found that these programs significantly reduced HbA1c levels and fasting blood glucose, while also improving patients' self-efficacy and their HDL cholesterol levels. Another important finding was that the patients experienced better outcomes when education was reinforced over time rather than delivered as a single intervention. Overall, this study highlights the important role nurses play in diabetes education and demonstrates that continued education, family involvement, and culturally appropriate support can improve long-term diabetes management.
Okay. So I'm going to be discussing the nursing implications portion of our presentation. So for my portion, I'll be discussing nursing implications. The nurses play an important role in helping patients manage their type 2 diabetes. And it also plays an important role in helping them understand what type 2 diabetes is. I know that this patient did express that she did not really understand the disease process of type 2 diabetes. So your nurse plays a role of like a counselor and an advocate when it comes to type 2 diabetes. For Hispanic adults with diabetes, education should be clear. Also make sure that it's culturally appropriate and based on the patient's personal needs. We also need to teach about medication adherence. And although sometimes the medication may have side effects such as fatigue, dizziness, and some patients even report feeling nauseous, we still need to teach patients that this medication needs to be taken on like a schedule versus like just taking it when you're feeling the signs and symptoms of hyperglycemia. Also, patients, I'm sorry, I forgot what I was going to say. Oh, also to go back to that, we need to teach patients how they can notice the signs of hypo versus hyperglycemia. And in this case, the patient did state that she has limited understanding of diabetes process and she struggles with medication adherence due to some of the symptoms. And because of that, we also need to teach patients that they need to report certain side effects. Not all side effects need to be reported. Like I said, dizziness and tiredness is something that will happen with a lot of the medications when it comes to diabetes, but those ones don't necessarily need to be reported. So it's important to teach patients which side effects and adverse effects they need to report versus which ones they don't need to report. Also, nurses should also reinforce blood glucose monitoring. And also with patients with type 2 diabetes, nurses need to teach patients to check their feet daily. And also to check one issue that a lot of patients with type 2 diabetes have is that they can't distinguish between really, really hot bath water versus really cold bath water. So we need to teach patients how to check for that as well so that they do not injure themselves. Oh, and then lastly, nutrition education is also important, but it should include foods that the patient actually enjoys and cultural food preferences so that the patient doesn't feel forced to do it and that the changes are realistic. Because obviously, if you tell a patient to eat something that they're not necessarily used to eating or that they do not like, they're not going to follow adherence. And also, physical activity should be encouraged, but in a way that fits the patient's lifestyle, such as walking instead of like traditional workouts. Like if a patient doesn't typically like strength lift, then you're not going to tell a patient, oh, you need to start doing this. Instead, you want to just tell the patient you need to be walking 30 minutes to an hour a day, or something easy for them, but that's still beneficial for their heart health and for their diabetes to keep their symptoms down. Oh, and another important implication is involving the patient's family members. This patient receives a lot of support from her daughter, which is great. So including family in the education can help improve adherence at home. Overall, nurses can improve diabetes management by providing ongoing education, identifying barriers for the patients, encouraging realistic lifestyle changes, and supporting the patient's confidence in managing his or her diabetes.
In conclusion, type 2 diabetes continues to have a significant and disproportionate impact on Hispanic communities, and this highlights a very important issue in healthcare today. What the research really shows us is that managing diabetes is not just about prescribing medication or giving general advice. It requires a deeper, more personalized approach. One of the key takeaways from this project is that culturally tailored evidence-based interventions have a real difference. When healthcare providers take into account cultural values, language barriers, family dynamics, and community influences, patients are more likely to engage in their care and successfully manage their condition. For example, programs that include culturally adapted education, community involvement, and even faith-based support systems have been shown to improve outcomes. These interventions help patients better understand their condition, stay consistent with treatment, and adopt healthier lifestyle behaviors. As a result, we see improvement in blood sugar control and an overall reduction in complications. Another important point is access to care. Many individuals in Hispanic communities face barriers such as limited healthcare access, lack of insurance, or limited health literacy. Addressing these barriers is essential if we want to create a long-term, sustainable improvements in healthcare outcomes. As nurses, this is especially important for us to understand. We're not only responsible for providing care, but also for educating and advocating for patients. By using evidence-based practices and being culturally sensitive, we can help reduce health disparities and improve quality of life for our patients. In closing, improving diabetes outcomes in Hispanic populations requires a combination of culturally competent care, community-based support, and better access to healthcare resources. When we bring all of these elements together, we can make a meaningful impact, not just on individual patients, but on the entire community. Thank you. And these are our references.